Ladies and gentlemen, good morning. I haven't got a fan, but as I'm a big hitter, I thought I'd better take my jacket off, so I was free to hit. Tim, Kate, Guy, thank you for inviting me to speak about the Armed Forces Patient Voice this morning. I hope what I'll cover is the value of listening and embedding at the very start of any programme, the value of lived experience. You've heard from Guy about my own cancer journey when I was serving, and I was treated brilliantly by the NHS. And I think that is what adds to my credibility, I hope, as chair of the Armed Forces Patient Group. Not everybody is aware that the NHS across all four of the administrations is statutorily required to consult with patient and public on the design and development of services. Certainly in the Armed Forces community, I don't think we were aware of that at all. And I think, Guy, you learnt that the other day when we were rehearsing for this. But it's a really important part of what the NHS do, and that's really what the Armed Forces Patient Voice Group does for the NHS England Armed Forces Healthcare Commissioning Team. But there are patient voice groups across the whole of the NHS, and many of you will be familiar with them in terms of participation groups at primary care level, citizens panels at ICBs and that sort of thing. And one of the things that I would say, which would help spread the word about the Armed Forces community and make sure the voice is heard, is for our community to educate itself about what opportunities are available. 7 years ago, when I started this work with Kate, I said to her, we need to embed the lived experience voice at the very beginning of the processes, because we're not experts. Most of us don't work in the NHS. It's a hugely complex area. And so we really need to be embedded. And what that looks like for us is early engagement with us so that we understand the brief. And we're quite good at receiving orders. Understanding the context of each issue in the global NHS situation. We need to have a transparent and continual feedback loop, which we need to improve in terms of involving our patients, families and carers. And I'm pleased to see Karen Ross here from the Families Federation and other members that we work very closely with in the group. But the other thing that we need to do, and we've heard this theme all the way through this morning, is we need to assure the outcomes for patients, families and carers, because these accreditation schemes are great, and they are great, and they've done some brilliant work. But we need to get to the next steps in all of this to assure the patient is getting an improved service. And that's part of what we do. We're not the only organisation that's involved in expressing patient needs or concerns or issues, but this is what we do with NHS England. And we work as equal partners, and sometimes the shape of that triangle changes quite naturally because of the priorities that the NHS are with. But for us and for the clinical reference group that's headed up by H, with members, and I know Dan Barnard's in the audience who sits on that group, we're working together all the time, looking at how we can improve the practices. And Johnson, what I would say to you is, we don't want the experience that you've had. And when I started this role 7 years ago, we had nothing. And I was talking to Tim and Guy earlier about sitting in a room in 2015 talking about the Veterans Covenant Healthcare Alliance for the very first time. And there was nothing. And so today, to have this room in Liverpool filled with all of you who are partners, patients, clinicians, deliverers, all working to make it better, I can assure you that it's not perfect, but it's a lot better than it was. Again, in identifying what good looks like for the armed forces community as a whole, we know that these bullets cover essentially what we need. We need help if we are in need. Mobility makes it very difficult, particularly for dual serving parents. We know that we've got to keep the defence forces physically fit to deploy and defend our nation. We know once we're veterans, having had everything given to us when we're in service, a same-day GP appointment, prescriptions as we ask for them, we know that's not going to happen in Civvy Street. And we need to understand that we need to take ownership of our own healthcare as we transition out. And so what we need there is help to navigate the complexity of the NHS systems across all 4 administrations. And there's a theme that I discuss quite a lot with Kate and the team and Andrea Collins, but actually we need to get better. And I think the MOD and the NHS could do better here, if I may, Kate, in terms of marketing what exists, because quite often we don't know what exists, and there's a hell of a lot more than there was. So we really do need to get better at marketing. And I would thank Kate for the resource that she's put in to marketing Op Courage and Op Restore, and downstream the Sexual Assault Referral Centres campaign that we're going to be doing in the early part of the new year, because we've said, they've listened, and we're about to get another improvement in our service. I think the other thing that I would say in here is that if it ain't working for patients, to quote H, it ain't working. And that's the other thing that we need to remind ourselves all the time, is patients should be driving this agenda. And that doesn't always happen. In terms of the Armed Forces Public and Patient Voice Group, we are the forum that helps to advise the Armed Forces Healthcare Commissioning Team, but we're not the only forum for that consultation, as I've mentioned. But we have representation from all 3 of the services, reserves, veterans, the serving, and their families and carers. And what we've developed is a group of expert patients, people who've had a training program, a proper induction, so that they get the context in which they're operating. And then we try to make sure that they're sufficiently through their recovery to be able to articulate what would make it better. Because we're quite a vocal community, we're pretty adept at whinging. And actually that's fine, because if we're identifying issues, that's okay. But actually we've got to help people understand what would make it better. And that's the criteria that we use. And that doesn't mean to say that everybody has to be fit as a butcher's dog, and you can tell by looking, fit as a butcher's dog, but actually they're not current with their health and mental health and physical health issues. So we've got to keep that balance. But actually, we've got to train our partners to be really knowledgeable and to help the team understand what the needs of the community are. We have got a very comprehensive training programme in place so that we are current on things like trauma-informed care. We've done the Armed Forces Champions training. There's a new pathway for the serving personnel in the context of sexual assault and abuse. Well, for veterans who've been out a long while, you know, it wasn't like that in my day. So it's really important that we keep up to speed with the improvements that are going on in service, which, as we know, if we read the media, you wouldn't believe there was anything good going on. And actually, there's quite a lot. And we have the families federations on the team, as well as people who are involved with military charities and the wider charity sector. And of the 40 members of the group we have, the lived experience covers a range of injuries and illnesses, some of which are comorbid, and people are still going through the challenges because mental health particularly isn't a straight line. But we've built a team that know that they can share information that would help them unload a bit if they need to. I think that's about it really with the group. There's an awful lot of good people in there, and they've been embedded with the team to develop. And I know you've seen a slide before, but this is an indicator, as is this conference, of just how much improvement there has been. So embedded in the development of these services have been patients with lived experience of the justice system, of physical challenge, and I can think of no one better than to cite in this particular regard than Paralympian Greg Stevenson, who I hope is coming to join us this afternoon. But he's part of our patient group. He's the lead for lived experience in his partnership, in his trust, and he's now a gold medalist at rowing. So the community as a whole continues to give back despite challenges. We're not always mad, bad and sad, but sometimes we have bad days. And I think it's really important. And the good thing about this is it gives our people purpose in helping to make stuff better. And again, and I can't thank Kate enough for the confidence she's shown in our group for allowing us to be embedded in all these things and to poke the team or people in the chest about what we need to do next, which I managed to do quite regularly, as did the whole team. But they're also champions and advocates of what we need to do to improve the service overall. Kate showed you the 9 commitments that have been derived from the forward view, and I'd just like to pull up this one on research. Because when I started this role 7 years ago, there was absolutely nothing for women, for the LGBT community, for ethnic minorities and Commonwealth soldiers. And the resource that's been put into research means that we've got Lisa Jarvis speaking this afternoon about the Female Veterans Transformation Service, programme, which is not funded by the NHS, but the research that led to the grant funding by the Armed Forces Covenant Fund Trust was kicked off by NHS England. The same detail with the LGBT community and the same detail with the ethnic minority and Commonwealth soldiers. So the research in the initial phase has been funded by the NHS, and that has led to a highlighting of the issues that need to be addressed for those groups that don't always get the attention they need. Just to highlight a number of the improvements that I think we've been able to influence. I wouldn't claim credit for it in any way, but we have managed, I think, to change the narrative about the NHS as a whole. And I say that because 7 years ago, I think people were pretty critical of the NHS, and they still are, but we've changed the narrative. It's better. The collaboration and vibe that I think we all feel in this room today is because people have confidence in the services that are being commissioned. And they may not be perfect, but they're a hell of a lot better than they were. And the integrated service that is up Courage, having fallen out of TIL's CTS and the high intensity service, is testament to that improvement and development, in my view. We've done quite a lot, and particularly in this programme and the RCGP programme, to educate NHS providers about the needs of the armed forces community. We need to continue to do that. And I'm delighted that that is something that is going to be part of the drive following the Armed Forces Covenant into law activity. I've talked about the LGBT community, but I'm really pleased to say that the OP suite of services were actually named by the Patient Voice Group in order to persuade a minister that we needed to have something that chimed with both the NHS and the armed forces community. And so influencing in that regard has been part of our role, because ministers like to hear the voice of veterans or members of the armed forces community. There's work being done on domestic violence and sexual assault, and I mentioned the campaign that's happening in the new year. Families, carers, children, we've got a lot of activity being looked at in that regard, and it's part of what we do. And we have a young woman on our voice group who's lived her entire life with a father with complex PTSD, and how that's impacted her, we need to understand. So that's been a really helpful thing. The serving military and the challenges that they have over maternity activity in the course of their service has been really difficult, and it's the same for dads. So the Lincoln Military Maternity Voice Project has been a really successful project, not just for women, but for the dads as well. We've looked at and are continuing to look at work in the devolved administrations for generating a patient voice grouping. That's in its infancy in terms of what we've done in NHS England. But as I say, they've all got to find a mechanism for listening to the patient voice. So we're doing some work through the partnership board with DHSC, with the devolved administrations and the Veterans Commissioners, to try and make sure that some of the good stuff that's been done in England is also being done there for the UK defence environment. And the other thing that we've been able to do is do some podcasts and some impact reports, some of which are spread around the room, to actually explain what the Patient Voice Group does, to explain some of the issues and what has been done as part of a marketing strategy for the community. And I think, as the Tesco chief executive would say, every little helps, but we all have a responsibility to ensure that we understand as much as possible about the environment in which we're working. I think my key message about what we should be doing for all of our community is to take away the message that you need to take ownership of your own healthcare. There was a marketing campaign earlier in the year about saying that you served. And that's a really important piece of activity, so that people can make a note on your medical records at any stage that you have served, or a partner or family member has served. It won't get you priority treatment, that's not what it's about, but it will highlight to providers the needs that they want and have to consider, or should consider, in dealing with a member of our community, because we've got specialist needs rather than special needs. So finally, what I would say is it's a legal requirement to consult. We have been totally embedded with the Armed Forces healthcare team at NHS England. It delivers better resource, and we've seen that because we've got better services. And I would ask all of you to urge your providers, your trusts, your integrated care boards, your GP practices to learn about the armed forces community and their needs, and embed as many of us as possible in the NHS system, so that the voice of the armed forces community is heard. Thank you.